the disease with 1,000 faces. Difficult to diagnose, complex, and chronic. It will strike 1 in 900 Canadians. Lupus. This autoimmune disease alters patients' lives, and if left untreated, can be fatal. At the BC Lupus Society, we provide support to people living with lupus. Because lupus is unpredictable, we strive to be dependable. Our programs include weekly support groups for patients and families in British Columbia. We make sure that educational resources and peer contacts are always available, including for patients facing a new lupus diagnosis. And every year, we help fund clinical training and medical research that benefit people with lupus. Through the BC Lupus Research Scholar Program, our goal is to advance treatments and discoveries to change the future of lupus. Our partnership with university researchers is unique in Canada and has helped understand the full impact of lupus and the effectiveness of lupus care. As part of our community, you're a valued part of annual events like our Lupus Gala and the Shed Light on Lupus Walk. These fundraising activities generate just part of the funds needed to sustain our work in patient support and medical research. With the generous support of donors like you, the BC Lupus Society will continue to be here for patients and families affected by lupus. Not only can we change tomorrow, we can brighten today. Thank you from the BC Lupus Society.
Hello everyone, my name is Dr. Azin Ahrari and I am a rheumatologist practicing at the Lupus Clinic at Mary Pack Arthritis Centre in Vancouver, BC. I also practice in Fraser Health Authority and Surrey Memorial Hospital. It is an honor to be speaking with you today as part of the 32nd Lupus Symposium. Over the next 15 to 20 minutes, I would like to share with you what we know about nutrition and exercise in lupus and how we can use this to improve lupus disease activity and our overall health. I will start off with a case. This is Jasmine. She's a 55-year-old female who recently developed facial rash, pain in her joints as well as swelling, hair loss, and fevers. She also was noted to have impaired kidney function. She has been seen by a rheumatologist as well as a nephrologist, a kidney specialist. She has been sent for a number of investigations, including extensive blood work and a kidney biopsy. Based on the results of her tests, as well as her clinical presentation, she has been diagnosed with lupus and lupus nephritis, which is lupus affecting kidneys. She has been started on treatment with hydroxychloroquine and mycophenolate mofetil, and she has started to notice improvement in her symptoms. She is wondering if there are any lifestyle changes, such as dietary changes or exercise, that are recommended for patients with lupus. Her questions are specifically, number 1, are there any diets that are beneficial for patients with lupus? Number 2, are there any natural supplements recommended for patients with lupus? Number 3, are there any foods that she should avoid because she has lupus and lupus nephritis? And finally, how important is exercise for treatment of her lupus and her health in general? So let's talk about diet and nutrition in lupus first. Systemic lupus, or SLE, is a chronic disease, and it can be treated with a variety of medications, but it does not have a cure. And naturally, many individuals with SLE want to know if what they eat or drink can be used as part of the treatment for their chronic disease. Before we talk about diet and studies related to diet and lupus, I would like you to be aware of the limitations related to these studies. As you know, lupus is a very complex disease, and the studies of nutrition in lupus are difficult to conduct or carry out, and they rarely pinpoint a specific food to eat or avoid. These studies are limited by a number of factors, including small research size, small effect size, and biases and confounders that are difficult to avoid or control for. Some of the studies that I will talk about have extrapolated results from studies in mice and other animal models, and these are not the same as humans, and the findings are being extrapolated, so there's limitations. And there are several clinical studies that have identified certain eating patterns have been associated with lower risk of inflammation and a reduced risk of chronic and autoimmune diseases. And I will be sharing with you some of this information over the next few minutes of our presentation. Many of you have heard about the anti-inflammatory diet. This is a diet that's rich in fruits, vegetables, whole grains, nuts, beans, and is low in consumption of processed food. While this type of diet is unlikely to cure lupus, it may reduce some of the symptoms and improve overall health of patients with lupus. We know that chronic diseases such as diabetes, heart disease, and stroke happen more frequently in individuals with SLE and can occur at a younger age. And this type of anti-inflammatory diet can reduce the risk of such complications in SLE. Furthermore, a study of 185,000 women was designed to prospectively evaluate impact of healthy lifestyle in incidence of lupus. The study was published in 2022, and it showed that a healthy lifestyle, which is defined by 4 or more of health factors, including diet, no smoking, exercise, healthy BMI, and moderate alcohol consumption, was associated with nearly 50% lower incidence of lupus. So in other words, 50% less lupus disease developing in this population. An example of an anti-inflammatory diet is the Mediterranean diet. This is a pattern of eating that is commonly seen in countries around the border of the Mediterranean Sea. But the foods that are consumed or avoided in this type of diet can really be applied to nearly any culture in the world. Mediterranean diet is rich in fruits, vegetables, whole grains, olive oil, nuts, and moderate amounts of fish and chicken, and it limits the consumption of red meat, sugar, salt, and processed food. Meta-analyses have shown that Mediterranean diet is associated with reduced risk of cardiovascular mortality, Alzheimer's disease, and even cancer. Mediterranean diet is associated with lower risk of developing rheumatoid arthritis, and in patients who have rheumatoid arthritis, if they consume Mediterranean diet, they're more likely to have better disease control. There has been a clinical trial that divided patients to 2 groups. One group of patients were given general information on healthy diet, and another group of patients were given treatment of the rheumatoid arthritis, as well as enrolled in a 6-week hands-on Mediterranean diet cooking class. And at the end of the study, patients who had received the instructions and cooking classes on Mediterranean diet actually had better disease control of their rheumatoid arthritis, better pain control, and better physical function at 3 months. While lupus is different from rheumatoid arthritis, we feel that the Mediterranean diet is likely to benefit patients with lupus as well and help control the overall systemic inflammation and improve the overall health of these patients. Jasmine asks, well, what about supplements? Are there any supplements that I should use in order to control my lupus better and improve my health? Omega-3 is shown to help create anti-inflammatory mediators that help resolve inflammation and restore immune tolerance. Omega-3 has been shown to inhibit production of many inflammatory cytokines, for example, IL-6, IL-1, IL-16, IL-17. These are examples of inflammatory cytokines. There are three kinds of omega-3. ALA, which is obtained from plants, and EPA and DHA, which are mostly obtained from fatty fish and in small amounts are produced in our bodies. Omega-3 fatty acids are found in high concentrations in cold water fatty fish like salmon, as well as flax seeds and chia seeds. A study looked at 237 patients with lupus nephritis and divided the patients into two categories. One category or one arm received medications that are used typically for treatment of lupus nephritis, plus fish oil, and one arm was only given the medications. At the end of the study, they saw that patients who received both fish oil and medications had a higher rate of achieving remission, and that was 46.9 versus 32.6%. Population-based studies also suggest that omega-3 fatty acids may be helpful in combating some of the depressive symptoms or fatigue or sleep disturbances in lupus patients. Another category of supplements that are important to mention are polyphenols. Polyphenols are anti-inflammatory chemicals that are naturally found in many types of plants. They are the compounds that often give fruits and vegetables their distinctive color and odor or taste. Polyphenols are anti-inflammatory chemicals, and they're found in high concentrations in foods such as extra virgin olive oil, green tea, grapes, ginger, berries, and flaxseed. Polyphenols have shown to have immunomodulating properties that reduce inflammatory markers or inflammatory cytokines and affect the composition of our gut microbiota. Polyphenol intake has been associated with reduced risk of chronic disease. In fact, in some systematic reviews of polyphenol intake, they have been associated with a lower risk of cardiovascular disease and protection from developing diabetes. Another example of polyphenol is curcumin. This is a chemical that's found in turmeric root, and it has immunomodulatory potential in addition to antioxidant, anti-inflammatory, and anti-carcinogenic effects. Curcumin in 2 mouse models of lupus nephritis had been shown to reduce kidney disease. Obviously, this is a small number and it's only in mouse models. However, it is useful to know. In another study of lupus patients with lupus nephritis, individuals who consumed curcumin in addition to their standard lupus medications had more improvement in their kidney inflammation compared to patients who took only the standard lupus medications. Another polyphenol is the compound found in green tea. Green tea has been shown to have anti-inflammatory and immunomodulatory benefits. And green tea supplements have been studied in some lupus patients and mice with lupus, and they have been found to be beneficial. It was a randomized double-blind placebo-controlled trial, so that means a study where patients were randomly divided into 2 groups and received green tea extract versus placebo. And patients who had green tea extract, 1,000 milligram, 2 capsules a day, had overall better lupus disease activity control and better quality of life after 3 months. Again, this is in addition to the typical medications that are used for treatment of lupus, such as hydroxychloroquine or mycophenolate. So daily green tea extract in this study showed that disease activity related to lupus was reduced with the supplement, and quality of life was also improved. Vitamin D is a very important supplement to discuss in lupus. Vitamin D deficiency is prevalent in lupus patients because lupus patients avoid the sun as they're photosensitive. They wear sunscreen as part of the management of their lupus, and also some of the medications that are used for treatment of SLE can actually alter the metabolism of vitamin D. Vitamin D is very important for regulating immune system function. It's involved in antibody production and inhibition of inflammatory cytokines. The link between vitamin D and lupus is actually two-sided, such that SLE or lupus may lead to low vitamin D levels, but also vitamin D deficiency may have a role in aggravating lupus. Therefore, it's important for patients with lupus to take vitamin D supplements, that's typically 1,000 to 2,000 international units daily, in order to ensure that they have adequate levels of vitamin D for bone health and also for lupus disease control. The next question Jasmine is wondering is, are there any foods I should avoid because it could make my lupus disease worse? The answer to that is a couple of things. Sugars, though they're not studied in lupus specifically, we know that sugar reduces the density of beneficial gut bacteria and exacerbates autoimmunity through activation of some of our inflammatory pathways such as TGF-beta, and also promotes inflammatory cell differentiation. So avoiding foods with low glycemic carbohydrates such as white bread and foods that are high in sugar such as jam, dessert, candy, prepackaged oatmeal, juice, and soda is important in order to make sure that there is healthy and beneficial gut bacteria and reduced overall autoimmunity. Healthy sources of sugar, such as grains with high fiber and fruits, are preferred sources of sugar for patients with lupus. Salt. There are no studies evaluating the effect of salt on lupus. In mouse studies, high salt intake has worsened kidney function, kidney disease in lupus, and we know that salt can worsen high blood pressure and kidney problems. Sodium also increases activity of inflammatory cells, that's Th17, and reduces functional cells that regulate our immune system. So avoiding processed foods, fast food, and adding salt for seasoning can be beneficial in improving overall health and improving blood pressure control and potentially lupus disease activity in the kidneys. Lastly, but not least, Jasmine asks if exercise is important in lupus. And the answer is yes. A prospective observational cohort study of patients with lupus compared inflammatory cytokine and gene expression among active patients that were exercising 30 minutes a day for 3 days a week versus patients who were inactive and didn't have that level of exercise. This study showed that physical activity correlated with increased levels of inflammation in the body. And so incorporating regular exercise may not only improve the overall health, but it may also improve lupus disease activity by reducing inflammation. In summary, the following dietary and lifestyle changes may be beneficial in lupus patients. I want to emphasize that these changes are important in conjunction with the standard medications for lupus, that is the hydroxychloroquine, in some cases other medications like mycophenolate, and careful sun protection using sunscreen and sunblock. The dietary and lifestyle changes that may be helpful in improving lupus and improving overall health are following a Mediterranean or a plant-based anti-inflammatory diet, consuming foods that are rich in omega-3 such as salmon, flaxseed, and chia seeds, consuming foods that are rich in polyphenols such as turmeric, green tea extract, extra virgin olive oil, grapes, ginger, berries, and flaxseed, avoiding added salt and processed sugars, taking vitamin D supplements and foods that are rich in vitamin D, and incorporating regular exercise into our routine. This brings us to the end of our talk. I would like to thank you for your participation and attention. If you have any questions, please send them to info@bc.org or save them for our Q&A session coming up.